Start our press briefing today. We came here to announce about establishing the coalition of NGOs, civil society organizations with respecting human dignity. Here you have representatives of this coalition, and they will explain why they came to decision to establish such a coalition and to promote formulation of the state policy on drugs. This year, Ukraine will participate on special session of the European Commission devoted to drugs and drug circulation, and Ukraine will need to explain how it is going to find solutions to the situation which we have in this area today. That's why human rights activists, healthcare organizations, medical workers, and civil society organizations, they have formed this coalition, and I invite Ms. Olena Kucheruk, who is acting active director of Public Health Program Initiative of the International Renaissance Foundation. We are preparing to this global discussion about policies as to drugs and drug circulation in the entire world. Currently, there are discussions in this area, and Ukraine could become one of the leaders at the regional level in stimulating such discussion. That's why international Renaissance foundations had supported establishment of the coalition respecting human dignity, which unites representatives of various medical associations which deal with the medicines containing drugs in their professional everyday work. There are patient organizations which know quite well how important it is to provide access to patients to special drugs releasing pain and also in substitutive treatment. There are also representatives of various human rights activist organizations. There are representatives of religious community which support establishing such a development of such a policy. Our activities is based on two pillars. One is to bring under control the access to necessary drugs. And the second pillar is to prevent excessive criminalization of the drug addict persons. And our prisons are full of those offenders whose offenses are criminalized because of the dissemination of drugs, storage of drugs, etc. Thank you, Olena. I would like to give the floor to Mr. Volodymyr Tymoshenko. In the past, he was the head of the state service on medicines dissemination, while today he is president of NGO Institute for the Study of Drug Policy. Thank you, Olena. The establishment of this coalition respecting human dignity is result of our 6 months work and efforts, and we clearly understand that today we have to legalize to pass at the state level the policy which we developed, but it is almost impossible. Today we observe that state institutions which should take care about implementation of the policy in the area of access to drugs and drug dissemination, they are quite indifferent to all those issues. Quite often in the past, we observed that passage of very good documents did not help in implementation of those documents and improvement of real situation. Although lessons from the past forced us to unite our efforts, and all our organizations which formed the coalition are different in their general purposes, objectives, methods, but we are united by a joint concern about drugs, criminalization of drugs, drug circulation and trafficking. The United Nations are going to have special discussion this year, and Ukraine, of course, will send its delegation. And we are thinking how to represent Ukraine's policy in this issue. We would like to prevent regress. We would like to prevent any steps back from the main course and commitments that we made at the European level as the state of Ukraine. Ukraine made specific commitments in the association agreement, and it has to think how to implement them properly. We believe that we have to stimulate governmental institutions who should take care about implementation of those commitments taken by Ukraine. And they have to play leading role in this and big role. Of course, NGOs and civil society organizations would not stay aside. We tried to develop the form of cooperation with the governmental institutions, which would allow us to implement the goals which we set in our suggested draft policy. We have developed the program and action plan for implementation of the strategy with specific deadlines for each year. Unfortunately, when we observe how governmental institutions tackle the problem, we see that they are moving very slowly. I would like to give the floor to Madam Oleksandra Bratsiun, who is representing the Sobornist Charity Foundation. Dear colleagues, I would like to say that the problem of drugs should be carefully studied. Research should be carried out, and the government should be very closely involved, and the state should be closely involved. Under the state, I mean both the government and the broad public. That is, we have to understand those who suffer from this situation now. As a medical worker, as a doctor, and as civil society activist, I know quite well that those people who require medicines containing drugs in the formula, they suffer because of limited access to those medicines. And those officials in the state who, within whose scope of responsibility this issue falls, they should come together and find solutions to the problems. We invited religious leaders, representatives of various churches to join our coalition because they quite often make emphasis on moral issues, on ethics of the drug circulation, and these are the issues which we should also keep in mind. Another aspect, this is raising public awareness about drugs. This is a huge and important component of the prevention policy. The prevention should be a huge component of the national drugs policy. As well, we should think about rehabilitation after anti-drug treatment, anti-addiction treatment. That is, Ukraine should bring together all the interested stakeholders whom I mentioned to develop the full-fledged anti-drug policy and well-balanced anti-drug policy. Now, I would like to give the floor to Ms. Larysa Lavreniuk, head of Ukrainian Pediatric Palliative Care Network. The WHO organization proves that palliative care is a good solution for those children and patients in general who need the relief, the pain relief medicines, and annually the numbers of those who require the special medicines amounts to 500,000 people, and around 1,400,000 of them are children. The biggest problem for those patients in the last stages of their life is access to quality pain relief drugs. Thus, we have demorphine medicine, and access to it is considerably liberalized. But nevertheless, the serious patients with serious diseases who require palliative care they feel a big deficit in pain relief drugs. Thus, especially acute this problem is for children. Medical personnel has no sufficient skills in palliative care. The hospitals rules do not provide any opportunity for palliative care, and usually such patients are sent home, but at home they do not have proper conditions. Also, unfortunately, we do not have these special palliative care drugs in a form proper for children, like in liquids, etc. We call for rational regulation of the drug circulation to prevent any such suffering and difficulties for small children. With this, I would like to give the floor to Ms. Liubov Syvak, head of the department at the National Cancer Institute. Good afternoon, dear colleagues. Annually in the world we have up to 6 million patients with all kinds of tumors, and out of 173 100,000 patients which are diagnosed in tumors annually. Some 1/5 are those who require this treatment. At early stages of cancer, 20–30% of patients feel pain, but at later stages of cancer, the percentage of patients suffering from pain is much bigger. Usually, the pain relief drugs and treatment should be carried out in line with nationally approved standards. Those patients who require continuous pain relief, they undergo this palliative care treatment. Usually, these patients are under supervision of their oncologists and family therapists. And when those patients stay at home, unfortunately, quite often they have no access to palliative care drugs, palliative care medicines, and this was the main incentive for us to join this coalition to ensure the rights for those outdoor patients, outpatients who stay at home at later stages of cancer. What is the situation in Ukraine with those patients who stay at home? I'm Syvak Liubov Grigorievna. I represent two organizations. I represent the Ukrainian Family Medicine Association, and also I represent the Ministry of Health. Of course, now we undertake huge scale educational course for our doctors to explain the resolution number 433 of the Ministry of Health about pain relief strategies for patients. And we have to take care about cancer patients. We also should think about the drug addicts and how to help them. What I would like to mention today, that when we explain the resolution number 433 at central level, there is a bigger understanding, while when we go to the regions, to local areas, we find out that the old instructions and old approaches are used. So the biggest issue is to find joint solutions, for example, with the Ministry of the Interior, to find contacts with those people from the Ministry of the Interior who were at the local level. Also, with this about storage of drug-containing medicines, about purchases of drug-containing medicines, there are a lot of issues. Also, we have to coordinate the dissemination of new, more advanced instructions about dissemination and circulation of drug-containing medicines. Those people who come to our seminars, we receive explanation that pain relief is the main issue for seriously ill patients, and for them, pain relief is extremely important, and we should not deprive them from this right. On the other hand, we should provide assistance to and preserve health of broad public. What are your suggested solutions? And what will be your next steps? During February, we plan to establish public dialogue with the government bodies, the State Service on Control on Drugs, on supervision of drug circulation, with the Ministry of Interior and the Ministry of Health, and to establish contact with those members of our delegation who will represent the country at the conference in April, the UN conference in April. We need to understand who will represent the state. We found out that positions of the three ministries involved in this issue, their positions are very different, and we would like to participate in developing their joint position and to present opinion of the broad public. In March, we plan to hold an event with participation of President Kwasniewski and Michelle Kazachkin, where we will have a broad public discussion with involvement of government officials. At this event, we will discuss Ukraine's position at the future UN conference. Any further questions? So please represent your final remarks. Well, in this case, I would like to give the floor to Mr. Tymoshenko. Currently, we observe systemic violations of the human rights of those who are patients because of excessive criminalization of drugs use. And what solutions you might offer in this case? So that is what we are continuously discussing, the balance between the interests of the patients and human rights. So first of all, we have to tackle the challenges which the patients, seriously ill patients face, those who need pain relief, and the drug addicts also. That is our suggested policy is aimed at these two things. Unfortunately, there are a lot of stereotypes about drugs in this society. It's so difficult to overcome them. We managed to repeal the famous Order number 11 of the Ministry of Health, which reflected very old stereotypes and approaches with the prevailing criminalizing approach and with the prevailing suppression of the patients. The major objective of that order was to prevent the leakage of psychoactive substances to general circulation, but the Ministry of the Interior broadly used all these bans and prohibitions to create a lot of corruption schemes. Quite often, palliative dissemination of palliative drugs was hindered by the fears that the Ministry of the Interior might take measures against such dealers. And today, the Ministry of the Interior makes has taken a position which is not very much clear to us because we today observe a lot of regress in this issue, in the attitude to drug policy. So those steps back forced us to unite our efforts. That is why we brought together all those who are familiar with all aspects of the problem and who are able to offer possible solutions. We decided to join our efforts. And one more issue, consumption of drugs. Everywhere in the world, the formulation of proper policy, of right policy in this sphere is a big problem for many countries, but filling jails with drug consumers is not the right way probably to resolve the issue, which brings us to the idea that we should reform our criminal code, introduce some changes, and to stop this shameful practice when drug addicts are clients of jails instead of being the patients in the clinics and hospitals. I think that I think that drafting new laws is not enough. This was proved by that famous resolution 333 by the Ministry of Health. That is, we should bring together government institutions and local authorities, local administrations, local law enforcers, and our institute from February launches a series of workshops at the regional level explaining the novelties which should be present in the legislation and which are already reflected in the legislation. I think this was a good conclusion. If there are no further questions, thank you very much. Dear colleagues, our next briefing will be at 12:30. We will have Colonel Lysenko. Що це час?